I know you saw that. So let's go ahead and listen and don't judge out loud, you guys. So these are the top 5 reasons I have seen this a common theme in a lot of my patients that come with gum disease or gingivitis. So please share this with your friends and family, and definitely you want to keep this video for future reference. Common one that I've seen, because I really like to interview my patients and really get to sit down and talk with them and get to know them and how do they come about, is depression. Now, when we think about depression, what do you mean? Well, imagine that you had a really bad breakup, or maybe you lost your job, or had a bad incident in your life that really affects you to your core. You actually don't want to get up and get out of bed, brush your teeth. Probably don't even want to shower. And also, you probably just don't feel like you want to put yourself first anymore. And I've seen this happen to a lot of patients. They express this to me. And before you know it, it starts to snowball. And now they've got all this buildup, their plaque hardening over time, becoming tartar and calculus. And that's what you're seeing here. And becomes to the point where they can't manage it anymore. And now it snowballs into a different type of depression. They're now embarrassed. They're worried about going to the dentist and getting judged. So that is a very common thing that happens. The next reason why I've seen this also happen is that they've actually had a very traumatic dental experience as a young child, even as a young adult, or even as an adult. And my patients have told me that they were either yelled at, screamed, made fun of, judged by either the dentist or even by family members, that to the point they felt like it wasn't a positive experience to go to the dentist. It became a negative event. And when we think of something negative, we don't want to associate with it anymore. So we're going to actually get away from it as far as possible. And that means going to the dentist and thus leading this situation. The third common reason I've seen is also poor oral hygiene. Now, this could be to lots of different reasons. And of course, that could be another video. But sometimes it's due to lack of education. Maybe the parents never taught them to brush properly. Because then, really, you think about it, nobody in school or ever teaches us how to brush our teeth properly or even how to floss. And sometimes, if the parents weren't taught about it, they're not going to instill and teach that to their kids. They might pass on their bad habits. Now, I commend to all the parents out there. If you were in this position and you know better and you're really trying, that's awesome. I'm hoping that people can break that barrier and really not have that basically perpetuate into a bad thing for their kids. But usually it is lack of education. Another part of that subpart reason is due to lack of money. So if a parent is working, not able to take their kids to the dentist, this is also a part of it as well. The fourth thing that I've seen is lack of motivation. Now, this has a lot of characteristics to what can cause lack of motivation, but it could be due to lack of education, money as well, or you feel like it's hopeless. And a lot of the times that my patients have told me is that they feel like, well, what's the point? My teeth are falling apart already. Why should I even continue brushing my teeth? And I like to motivate them, say, like, don't give up. It could look very grim, but don't worry. Let's continue to brush and take care of ourselves so that it doesn't spread and it doesn't perpetuate. Because remember, cavities and bacteria can spread, and you can go from one cavity to multiple cavities in your mouth. And one of the last 5 reasons that I have seen, and there's much more, you guys, but drug use, of course, and alcohol abuse is because when we start doing drugs, we're not really now taking care of ourselves. We're sleeping odd hours. We're just basically getting by. And we just don't feel like, what's the point again? And so, and then of course, a lot of the chemicals in the drugs do wreak havoc in the mouth, especially meth. So please share this with your friends and family. And if you have any questions, please go ahead and hit me up.